I'm Dr. Kurt Woeller. I want to talk about children who have seizure issues and seizure disorders. One of the things that we know, and one of the things we know in autism is it's relatively prevalent. 35, 40% of kids have some underlying seizure problem. And many of them are on medication, some aren't. Sometimes the seizure activity is not real identifiable, but it can contribute to behavioral issues, etc. So again, we know that this is a scenario that can affect many different types of kids, not all autistic, but other types of kids dealing with other types of issues. But I want you to think, if this has not been done, really, really strongly encourage you to do the organic acids test from Great Plains Lab. Now, I teach on this test to healthcare practitioners through seminars as well as online webinars and courses that I do. And I've been using this test for really almost the beginning of my practice, going back about 23 years now. And it's always important in any child, and I can even say this about teenagers or adults who are having seizures, is to analyze for organic acids. And organic acids are compounds that we all produce naturally as a reflection of our body metabolism. So for example, lactic acid is an organic acid that's elevated a lot of times if let's say you exercise real intensely or you had a recent illness, but it can be reflective of other things too. And then there are organic acids that get produced inside our body that are reflective of digestive system imbalances. And sometimes those organic acids that are coming from these microbes in our gut can negatively affect the biochemistry of our body, including our brain and nervous system. There are certain biochemical systems in the body related to fatty acid metabolism, related to what's called mitochondrial function, that if they are imbalanced, can increase the susceptibility to seizures. And those systems can be tied to other toxins that somebody may be exposed to or affected by certain nutritional imbalances, for example, like thiamine or magnesium, etc. And so these are important things to analyze to, if nothing else, rule out, because you want to make sure that your loved one isn't, just entirely dependent on medication that, may be covering up or making up for some kind of underlying biological deficiency or imbalance elsewhere. I get it. Seizure disorders are complicated in many situations, but from an integrative medicine standpoint, you've got to look at underlying biological factors that could at least be a contributing factor to, again, underlying imbalances that might make seizure disorders more prominent or somebody more susceptible. So the organic acid test is really critically important to do. Again, I'm Dr. Kurt Woeller. Thank you.